Hello, my name is Claire Carter. I'm the infant feeding lead here at the Royal Berkshire Hospital in Reading. I'd like to talk to you about the value of breastfeeding and the value of breast milk and how to feed your baby. When it comes to feeding your baby, you don't have to make up your mind before the birth whether you're going to breast or bottle. But from a baby's point of view, they can smell you, they enjoy the touch, they enjoy the skin to skin, and their instinctive behaviour will be to seek out your breast. So you might want to give it a go. Try it, see what happens. Your baby might enjoy it, and you might enjoy it too. Once you've birthed your baby, the midwives and other healthcare professionals will help you with the attaching of your baby to the breast. And you'll soon understand that once you've got the hang of it, it acts as a comfort to your baby, as well as obviously food. Colostrum is the first type of breast milk, and that is so valuable. It's really rich in these protective factors, especially the first 24 hours. Literally the first drink your baby has will line your baby's gut and ward off germs and bacteria from the get-go. So your newborn baby will take frequent small feeds at first. So respond to your baby's needs. Look at the feeding signals. A lot of parents think they have to wait for the baby to cry before they feed. But it's much better to pick up your baby, cuddle it and start feeding on the early signals. And this is when your baby is poking his tongue out, maybe moving his head from side to side, getting more fidgety. If he finds his hands, he'll be nibbling his fingers. So on those early cues, that's the time to pick them up and feed them. And understand that when your baby breastfeeds, it's going to be held nice and close. The baby's chin needs to lead into the breast. The baby's nose needs to be free of the breast. And the baby needs to suckle deeply. And you'll see that the baby has full rounded cheeks while it does this work. And it'll suckle away and then have some swallows, pause and go again. And as the feed goes on, the baby's agitation will get less. Little hands will relax. The whole baby's demeanour will relax as the tummy fills up. And you should feel pulling and drawing on your breast, not anything painful. Should you experience any pain, just remove the baby gently, ask for some help and relatch the baby with some support till you get the hang of it. As your baby feeds go on, once they've finished, they'll get pauses, will be more prolonged, they get more sleepy, and they'll just stop feeding, push the nipple out when they're done. They often want the other side. It's all going to depend on the appetite and what's going on with that particular feed for that baby and yourself. Don't forget to look in his eyes and help him understand what's going on. Once you've got out of hospital, you may need some further support. Initially, your community midwife and maternity support worker will visit you in your own home. And when you're ready to get out and about, there are lots of local support groups in the Reading and Berkshire area. Take a look in your red book for a list of current support clinics. Thank you for watching. You might have some questions now, so write them down and speak to your community midwife.